Hello, everyone. Thank you very much for joining us today. And I would like also to thank Community Foundation and their partners making possible this wonderful meeting today. Mental health issue, I would like to touch base on mental health issue. Huge prior to the COVID, especially for the vulnerable people. Mental health is a stigma, and many communities, including local people, have that common stigma when it comes to mental health. The fact that the COVID-19 back in 2020 added extra problems to the vulnerable people as well as the local people and everyone. Global Village Center had we did research in Brooks area and County of Newell as well as Medicine Hat back in 2017, 2018. The research was done in partnership with Medicine Hat College in Medicine Hat, the main campus. Dr. Nicole, Donna Wood, Dr. Elizabeth O'Brien from the main campus, myself, who is the South Shore Medical Clinic. At the time, the importance of the research was to find out the trauma those people coming from their home country, what they experience and when they come to Canada. It specifically was the PTSD. We had over 200 people that we had interviewed after the ethics committee from the Medicine Hat College the process. The people that come through that interview, they were immigrants that came to Canada back in 1970s, refugees, immigrants, and in between, all the way to the people who arrived 2016, early 2017. The findings was very alarming. 63% of those people have shown some sort of trauma and PTSD. That compounded when they arrived, the cultural shock, they came finding a different language, new culture, and dynamic of their families. The trauma they faced back home, that also created dilemma for them and prevented most of them to integrate to the society they are in. After the research, one of the outcome of the research was to create a place that we call Healing Path for newcomers. Healing Path Wellness Center for Newcomers is a project run by Global Village Center in partnership with many organizations in Brooks area as well in Medicine Hat College. The Healing Path Wellness Center, so far we have, it's not a clinic, but we see people in terms of their accessibility, help them the accessibility for the mental health and the resource that we have. Most of them have underlying issues like housing, immigration, and etc. And when we find there's underlying issues apart from their mental health situation that creates a problem for them, we direct them to other organizations that be able to help them. We also have a solid partnership with FCSS in our area. As of today, we have over 631 people in our waiting list waiting to be seen. Each individual coming to the Healing Path will be seen by a psychologist, professional psychologist, and cultural mediator. We provide only 3 sessions. After 3 sessions, we refer the individual to Alberta Mental Health in Brooks Clinic, which we have a very good relationship. Some of them do not wish to continue through Alberta Mental Health for their own reasons because of the stigma again, and we offer them to come back and we provide the service. Most of the service that we provide to the corporates in Brooks area. The simple reason is because those corporates, they pay that the service through their benefits. The other number of the 650, 51, 52, they are in waiting list that they have been referred by either their doctors or other individuals through the organizations they are dealing with. And we see them based on the need in voluntary basis. We cannot provide all of them that their need. We cannot be able to meet their needs. But we refer to them also to other counseling services in town, as well as Alberta Mental Health, and they don't feel like going there. That is the challenge that we have. This was in addition to that, they have a problem with the COVID. When the COVID hit back in 2020, created another dilemma of isolation, anxiety for those families when they are at home. The vulnerable people again, and low-income people, not only vulnerable people, those also low-income people. Housing issue also creates a problem because of the contagious of the disease, of the virus. They live together in high number. They work together with a car because of the limited resource that they have. Global Village, through the Healing Path, created a video clips promotion of the vaccine and also prevention of the COVID. We have provided those videos and you can be able to look at through our website. We partner with JBS company, which is the largest employer in our area. We provided to their employees at the plant, which is over 2,600, 2,800. And also we provided with different languages, the common language, the key languages, with the help of BCIS, SPEC, FCSS, and other organizations. We do believe the mental health is a huge and can be only prevented through education awareness. When people we empower people so they will understand the importance of their mental health and well-being, so they will be able to seek their own need when they can access the service that we have. One thing in Global Village Center and through Healing Path, we encourage and we do believe to our heart is if you empower individual and tell them, give them the tools, they will be able to succeed regardless of their background. We empower them, show them the accessibility, the service that we have, so they feel comfortable and they will be able to help themselves, their family, and in general, the community. Each individual is different. What we find through our research is the most difficult people that we see are those people who come from refugee background. Imagine when you are at home one day and you've been uprooted because of political, religious fanaticism, or in between. Those people who run away from problems, they lost hope, they lost everything. So when they come here, we need to show them empathy. Empathy is important for a human being to listen and value their perspective. Bring them in, show them how they will be able to succeed. Any family who comes here to this beautiful country, they came for one reason, safety of their family, and also progress and to see their kids succeed in life. Regardless of their background, that's the commonality of every person who comes either as a refugee or as an immigrant. We also have to be proud of Canada was built by immigrants and refugees. Einstein was a refugee running away from Germany. So refugees, immigrants is added value to the economic development of our nation going forward. how we are going to overcome the stigma that faces most of our communities, specifically to the refugees and immigrants. The reason that I keep repeating myself to refugees are because the most vulnerable people of all immigrants, when you put them all in one basket as immigrants, refugees will be the most vulnerable group of people. So the belief of empowering, whether the person is refugee or immigrant, to take responsibility on their own and have the importance of their well-being, I think that's what we need to do. Global Village Center now, in partnership with Medicine Hat, we are being given funding for 5 years to continue for the mental health of the newcomers, and they will be very much, we are on the 2nd year, and we hope to provide that also to the community. Thank you very much for listening. And again, if you need more information, please do not hesitate to contact us through our email or website. Thank you very much, and have a fantastic day, the rest of the day.